Hi, Dr. Stavis. I just wanted to send you this. One piece of the puzzle that I haven't told you is I started getting Botox every now and then in this muscle right here. It kind of helped with the this feeling because I can't, when I go down, of course it goes in, and I feel like my eye feels like it does this and not this. So I haven't had my Botox in about 4 or 5 months, and as you can see, I don't know if you can see, but you can see my eyes just feel like they're doing this constantly. When I blink, it goes in, and then I have to pull it out, and I feel so wide-eyed. The tissue is so sore between here and here. It's so dry. I don't know if you've ever seen a Graves patient. I don't have Graves' disease, but that's exactly what it feels like, that my eyes are getting wider and wider and wider, and I can't stop it. So this Botox helps because I don't know, it gives me something to work off of because it's very hard to look down, and it actually feels like I only use this part of this eye and I never use this part. And so if you can imagine just using this part all day, looking up all the time, it just makes you do that motion all the time. And the fact that when I blink, my eye goes in, and I have to, what feels like using my superior rectus to straighten it out. It also feels like I use this muscle. When I close my eyes, I always have a sensation that goes around. It's like a circular motion that goes around, and I feel like when I get the Botox right here, it helps with that sensation. And I've had many doctors that just don't understand, kind of blow me off when I say this, but this is truly what happens. After I had the surgery in 2004, the recession of the medial rectus, I was so wide-eyed, my eye still went in and I'd have to pull out. It felt so bloody and it hurt very much right here, but I had huge tension in my ear, kind of like I'm using, I don't know, am I using an oblique muscle to pull it out? Am I using my superior rectus and lateral to pull it out? Is there connective tissue? I know, I'm sorry for sending you these again. I'm trying to call a doctor to get Botox because I'm pretty much been in double vision the last few days because it hurts so bad to pull it out, because as I'm pulling it out, I'm also widening, I'm widening that. And so every time I blink, I have to get wider to pull it out, and my eyes, I don't know if you can tell, but pretty much look stark like this. This is me. I'm not doing anything. I don't have Graves' disease. I've been tested for myasthenia gravis, but it's almost like I have that lid retraction because I can't calm these muscles down, whatever is going on. So I'm really hurting right now, Dr. Stavis, and I just want us to explore everything, oblique muscles, and, again, my muscle, this left eye. And I know I look scary right now because you can see that all the whites are showing, but my muscle feels like I do this, and I really want to be able to do this, and I can't. And I think it also feels like every time I blink, I'm pulling something out or doing something because it needs that extra. I don't know. Could it be what you're talking about, or could it be something else? But again, I'm just in a very scary state. I'm not doing it, and it also feels like it's hard to move my eye left. I know I don't have Duane syndrome, but it doesn't feel right.